Welcome back. Dr. Anthony Fauci has been on the forefront of the COVID-19 crisis, and tonight he is already reflecting on the lessons learned during the pandemic.
Also sharing his message to people who are still on the fence about getting the vaccines, Doc.
Yeah, but first, I wanted to know, with the success of the vaccines, where mRNA technology could actually take us next. I'm curious, you have some of the highest level insight into my next question. One day, of course, this pandemic will end, and mRNA vaccine technology, which has now exploded to the forefront of public awareness, is going to demonstrate its other exciting uses. Can you talk maybe about the future of mRNA technology now that it's been so broadly deployed and tested?
Yeah, it is really an extraordinary breakthrough in vaccine platform technology, and we're already seeing investigators taking a look at the possibility of using that against HIV. A number of labs have already done preclinical studies in animal models of seeing if we can get the kind of immune response that has eluded us thus far with HIV. Influenza also, I think, is going to be an important area where mRNA vaccines are going to be used. It really is an extraordinary technique, highly adaptable. And when you get the right immunogen expressed, it induces an extraordinarily powerful immune response, as we've seen with COVID-19. Truly a major breakthrough.
Yeah, absolutely. I know I didn't ask you to bring your crystal ball with you, but decades from now, when other experts look back at this pandemic, what do you think the biggest lessons learned will be? I mean, maybe it was something like the emergence of mRNA technology. I don't know.
Well, there are going to be scientific lessons learned, and there are going to be public health lessons learned, and some policy political lessons learned. One of the things that I've always felt so strongly about, in the sense of it being unfortunate that we've had this historic pandemic thrust upon us at a time when there was extraordinary divisiveness in the country, where you were really having people making decisions about public health based on a political persuasion. That just doesn't work when it comes to global health and public health and domestic health, because the common enemy here is the virus. If you looked at what's gone on over the last year, it's almost as if we're fighting with each other instead of fighting in a common way against the virus.
Yeah, I'm not even sure I would say almost. I think we have been. I guess as a segue or another question, do you think that things would have been different if this had not occurred during an election year, basically?
I think there would have been some differences there because we had such a charged political atmosphere that, had people, in a sense, taking sides when they should all have been pulling together with regard to the public health recommendations.
Yeah. Well, I think that's one of the challenges of public health right now. And of course, as everyone knows, if public health is successful, no one knows about it. So, this is your time to really help the world. You, like everyone else, has put so many parts of your life on hold because of the pandemic. On a personal side, what are you looking forward to doing once this is truly over?
Well, I think it has to do with one of the questions you asked me a little bit ago. I mean, it being able to be with my family together, it's been a surrealistic year. I mean, ever since late January 2020, I have not had a single day off since then. I would like to be able to reconnect with the world as I know it, and probably appreciate things that I didn't notice before because I didn't really fully realize how much you depend on them for your daily happiness and existence. That's what I'd like to do, particularly with my family.
And I think that's probably what just about all of the world is looking forward to in many ways. Just one final question on vaccine hesitancy. Of course, it's a widespread concern. And frankly, I know medical colleagues who haven't been vaccinated. What would you say to the hesitant, I guess, to reassure them or convince them of the importance of getting vaccinated?
Well, it's a personal responsibility and it's a societal responsibility. I mean, we have a pandemic that has killed 550,000 people in the United States. You can't run away from those data. This is a serious disease. And people who think that because they're young and because they're healthy, they're exempt, that's not the case. We're seeing more and more young people getting seriously ill. And we all know that the vulnerability of the elderly and those with underlying conditions. It's a highly efficacious and safe vaccine. we can put this pandemic behind us if we all pull together and get vaccinated. So the data are strongly in favor of getting vaccinated.
Well, Dr. Fauci, this has been an absolute honor. I genuinely want to thank you for all of your work to get the nation through this difficult time. And personally, I want to thank you for joining us. Thank you so much for being here.
Thank you for having me. Appreciate it.
Now, frankly, I could have talked to him for hours, and if there is anyone who deserves at least a day off and a long vacation, it's definitely Dr. Fauci. But unfortunately, I don't think he'll be taking that vacation for quite some time. Back to you.
Great conversation.
We would put Frank McGeorge in that
And
category, too.
Exactly. He's
Yeah.
been working 2 jobs, yeah.
Well, as fast as people get vaccinated, scam artists are coming up with ways to trick us out of our personal information.
That's right. Tonight, Help Me Hank consumer investigator Hank Winchester shows us why these scams are so prevalent right now.
These scammers are out there, and they're focused on one thing: tricking you, getting your personal information, and they're preying on people desperate to get their vaccine. It's a growing crime, and there's a new disturbing trend. As more and more of you are being vaccinated, more shots going into arms, it means more scammers are out there looking for those of you still seeking an appointment.
As soon as the vaccine came around, we saw all kinds of fake scams related to that.
The concern now that victims are providing their personal information to these high-tech thieves. As a result, they're getting their identity stolen. In Michigan, ID theft cases are surging right now. Never provide your personal information to someone you don't know.
You need to make sure that you're ignoring any immediate calls for action, because they are hoping that high-pressure tactic is going to get you to bite.
These scammers are sending text messages and emails asking you for your social security number and your date of birth. Sadly, some desperate for appointments are providing this information, and these crimes are being carried out all over the area.
Most of the time when you see those numbers that you don't recognize, it's a robocall, and it's likely an illegal robocall of someone who's trying to scam you.
The AG wants to remind you that the vaccine is 100% free. It shouldn't cost you a dime. Some are being told they have to pay up in order to get it. That is simply not true.
You shouldn't be charged a copay or anything of that nature. They can charge your insurance company for administrative costs, but really most of the time you shouldn't be having to give any of your medical insurance information at all.
The Attorney General makes it very clear: if you get a phone call, an email, or a text message from somebody that you don't know, and if they're asking for personal information, the best thing you can do, ignore it. Back to you.
Hank, we appreciate it. Dr. McGeorge is back to answer your questions next.
If anyone could just walk one day in our shoes and see what we see, it would be no hesitancy.
Checking back in with frontline workers, what they're seeing, hearing, and feeling now that the vaccines are here.